Hi everybody, wish you all a very good afternoon, and I'm back again here today to discuss some more interesting things in the field of skincare. So hi, I'm Dr. Rinky Kapoor, and I am the director of the Aesthetic Clinics. So the Aesthetic Clinics is a chain of skin and plastic surgery centers which are located in multiple places around Mumbai, and we also have centers across the country in some of the major metros across the country. So we provide aesthetic care services related to skin, cosmetic surgery, hair care, etc. So today we'll be discussing something that's very, I would say, dear, especially to women's hearts, and we all like to get it done. I mean, it's not just women, now it's the men also. So that's the word that's called as facial, right? And I'm sure a lot of us have gotten facials done at some point in our lives, and we like the enjoying, relaxing, soothing feeling of facials. We go there, we are pampered, we relax, we lie down, sleep for an hour, and then feel rejuvenated and come back. So this is the age old facial that we all know about, the cleanups, the facials that are done. But as technology has advanced and as medical science, as aesthetic science has advanced, now we have the same facials which have turned into something scientific, turned into something which is medical grade, and something which is actually helpful for the skin. So it's now not just a cosmetic treatment which is like a feel good factor. I'm feeling tired or I'm having a function and I need to look fresher, and so I'm going for a facial. It's no more like that. It's become something which is you can say scientifically tailored to suit the needs of different skin types, with awareness increasing nowadays. A lot of people are aware of their skin types, what their skin needs, what is their skin problem. So now we have customized facials, we have scientific medical grade facials which are available, and this is what is called as medifacials. So these are medical grade facials, these are scientifically proven, these are actually therapies, and it's not just the feel good and the relaxing facials which we used to do in the older times. Okay, now what are these facials and where are they done, who does them, and what is the difference of between these facials and the age old facials that are available? I'll just say this in a nutshell now because I'm sure there'll be questions on this. So these facials are done by therapists, and typically at a dermatologist clinic you will be getting these facials at a doctor's clinic, and there are different categories of this which are available depending upon the skin type of the individual. So whether it's being done for dullness, whether it's being done for pigmentation, whether it's being done for anti-aging, it's being done for pimple reduction. There are so many different indications, there are so many different reasons why this should be done, and these are somewhere between actual doctor treatments and the salon therapies. So these are somewhere in the intermediate. So you can say they are done for milder conditions of the skin which require some basic treatment and maintenance. So for such category of patients, and for patients who want to do maintenance after they have done their skin treatment or the treatment of the skin problem that they have, for maintenance these facials can be done. So this is what is medifacials. They are done by therapists, they are done at doctors clinics and offices, and rest assured, because they are scientifically proven, the chances of side effects, the chances of problems with these will be minimal, or rather non-existent. Okay, because they are tailored to suit to different individual skin types. Also in these now let's come to the differences between these facials and the traditional facials which are available now. Traditional facials are like the beautician will evaluate your skin and she will suggest you one of the types of facials that are available. Typically, you lie down there, the skin is cleansed, it is scrubbed, and then they apply certain creams, they massage the skin, and then they put a pack, etc. They remove blackheads, they'll give you some steam, and that's how it typically takes about 1 hour or so, and that's what is a traditional facial. So it is basically a passive facial, as we call it. Passive means you just go, you're not doing anything. There's just being a massage, some stimulation to the skin, the blackheads, etc. being removed, and you're relaxing and going off to sleep. So this is, your skin is not doing anything, you are not doing anything in this, no participation, and that's a passive facial. Now a medical grade facial or a medifacial on the other hand is an active facial. Now active facial meaning, here we have a combination of different medical grade serums, creams which have medical grade medicinal ingredients incorporated into them, along with certain new generation technology, that is some machines which are available which stimulate the skin on the desired area. So say if you've got you want to do it for anti-aging, we have therapies like machines which provide radio frequency, which provide microcurrents, etc. to stimulate the muscles of the face, to tighten them. So that is for anti-aging. So there's a technology that's involved in addition to the active serums, etc. which are used, and the massage that is used. Then if you want to go in for pigmentation treatment, then there are certain treatments like peels, etc. which are incorporated as part of the facial to improve the pigmentation. So and then if you need to say go for acne treatment, then you have things like the LED lights, the photofacial which is there, which is incorporated into the facial therapy to treat the acne or to treat the pigmentation or to treat the anti-aging facial. So these are machines which are used by therapists in addition to the massages, in addition to the serums, in addition to the medical grade creams to give you the results. So this is an active facial. Your skin is working, the machines are working on the skin, the muscles are getting stimulated, the acne is being treated. So it's an active facial. You're not sleeping. I mean, you're all the time. So the first step will be the massage, then will be cleansing, scrubbing of the skin, then will be comedone extraction, then you will have machines that will be incorporated. Say you might go in for the microcurrents or the radio frequency for skin tightening, you might go in for the LED mask for skin rejuvenation, you might go in for the microdermabrasion to scrub the superficial layers of the skin. So these are machines and technologies which are incorporated. Okay, so that is why it's called as an active facial. The muscles are working, the skin is working, the technician is working, and you are also wide awake. Oh yeah, what's happening to my skin? Oh, it's feeling so good, and the dead layers are getting scrubbed off, the muscles are getting stimulated, you feel the vibration in the skin. So this is the basic difference. Okay, now the other difference is that a salon grade facial is generally used as a maintenance. They use the age-old products. There are some standard products that are available. There is a bleach and all of this is all standard products. Whereas in the medical facials, you have active products which are used. It's not just the massage, etc. We also include products like retinols, like vitamin C. We have microdermabrasions, we have peels, etc., etc. So it's a passive facial. It's a stimulating facial. It is used for treatment of a problem. Say you have mild acne, or you have mild pigmentation, or you have mild sagging of the face, of the neck, etc. You have mild under eye dark circles. So these facials can be used for treating these problems, and once they have been treated, they can be used as maintenance regularly to keep these problems under check. So this is the difference between the traditional facial and the medical facial. So now what we'll see is, I think there are a lot of people who have joined. So some people want to ask certain things. I just wanted to mention here that the different types of medifacials that you see generally that are available in the market. So there is something called as a Hydra facial. That's really common, and I think a lot of us have heard the name. It's called as Hydra facial. Then you have something called as a fire and ice facial. You have something called as a Korean glass glow facial, which is a signature facial from the aesthetic clinics. And then there are facials like the anti-aging facial, the OML facial, and red carpet facial, and so on and so on and so forth, vampire facials. So these are all the medical facials. These are the names which you might have heard, and you might be interested in knowing what is this. Okay, so there is a question which is what is hydrofacial? Okay, now hydrofacial is a medical grade facial wherein of course you do the cleansing, toning, scrubbing, etc. But there is a machine, there is a technology that's called as hydrofacial. There's a name of the machine which is used, and it has certain probes which are attached to the machine. It has certain bottles of serums, different sort of serums attached to the machine, and what they do is they have this suction which is there in that probe. So with the help of the suction, the skin is sucked into the probe, and then with the help of the jet which is there, so there is a jet, so there is a suction and there is a jet. Okay, so with the suction the skin is pulled, and then with the jet spray the active serums are penetrated under the skin with the force of the machine. Okay, so it's not painful, it is very relaxing, and it's doing the job at the same time. So what happens is, as the serums etc. penetrate the skin much deeper, they hydrate the skin better and they do their job much better because the penetration is higher because of the suction and the jet spray that is applied. Okay, so that is basically the hydrofacial. It gives a very good glow shine to the skin, and it's also very good as an anti-acne facial. Your dermatologist consultation is important. See, if you go for any medifacial, you must consult first with your dermatologist or with your aesthetician, and then after your skin is assessed, once they tell you which is the best medifacial that is good for you, then you can go ahead and get it done. That's when you will get the maximum benefit. So this is about hydrofacial. Then there is another question, what is Korean glass glow facial? Okay, now Korean glass, as we all know, Korea is one of the hubs of cosmetic medicine, right? And these people have really clear, good looking skin, you know, skin which shines like glass. It's so clear. So that is what is glass glow, glass like glow to the skin. Now, how can you achieve this? See, of course, there are a lot of things that go into it. It's your lifestyle, it's your diet, your exercise, the way you manage your skin on a daily basis. But there's something called as a Korean glass facial, which is a combination of different machines and technologies which are incorporated into that facial session which is done on the skin. So typically it has cleansing, scrubbing, exfoliation, and then you have the comedone extraction, and then you have something called as microdermabrasion, which is also called as skin polishing, which is done to scrub the dead layers of the skin. Then there is something called as chemical exfoliation, which is done wherein some specific peels are applied. These peels are customized by the doctors, just like it's done at the aesthetic clinic. So we customize the peel that has to be applied on the patient's face depending upon the type of the skin. Okay, and then you go ahead and do something called as radio frequency, which is given for skin tightening, and then you do something which is called as electroporation, which is to penetrate the serums that you're using for massage deep into the skin. So this helps the serums to get in deep, and then you have a combination of all this along with the hydrofacial. So this is what in a nutshell is the Korean glass facial. And after getting this facial done, you will see for yourself there's an immediate instant glow into the skin, and 1 or 2 days down the line the glow improves significantly further. One thing to remember, these treatments, the medifacial grade of therapies, should be done repeatedly. So you can do it once a month or once in 15 days initially for about 3 to 4 sessions, and do it once in every 1 or 2 months for maintenance to keep your skin nice and glowing. Okay. Then we have a question from someone who's asking, why is hydrofacial so expensive and can the procedure go wrong? Yeah, hydrofacial is a very specific technology, as I've explained the technology, and it requires a particular kind of equipment to do it. So there are many simple things that are available. There are many copies of the machine that are available. So you need to be careful of the place you are going to get your hydrofacial done, because the machines need to be FDA approved and good quality to give you good penetration into the skin and good hydration. So that's why it's expensive. And yes, the treatment has no side effects as long as it's being done by an experienced therapist and an experienced technician. In general, medifacials do not give any problem. Then we have a question, okay, what is the preparation that is required before medifacials? Of course, good cleansing, toning of the skin, use of good sunscreen, a basic skincare routine is something which you need to follow. Please consult your aesthetician or your dermatologist the place where you're going for the medifacial, as in to get to know which sort of facial will be suitable for your skin, right? So that is the preparation, and come with your mind open, with your eyes open, see what is the benefit, see the instruments, see the effect on the skin, and you will really enjoy the results. Okay. How often should one undergo medifacial is what Anuradha is asking. So it depends. In some cases we do it every 15 days for the first 3 to 4 sessions, and then put the patients on maintenance, as in once or twice, one in 1 month or 2 months he or she can repeat the facials. Now another question, are these good enough for men? Of course yes, why not? So men also have the right to pamper their skin and to look good, and to enhance their looks, to enhance their skin, to take care of the skin. So medifacials are as effective and as good for men as well as women. Right age to start hydrofacial? Preeti is asking this question. Okay, so the right age, of course, once you reach the age of 16-17, you can go in for these facials. There is no problem at all. In fact, they are really safe. Even above the age of 15, it's fine, but in general, we recommend it once you cross about 16 years of age. And yes, there is a question about what are the side effects of medifacials. Side effects per se are nil if the therapist is good and they know what they are doing, because medifacial incorporates technology, techniques. So the person who is doing it for you needs to be trained adequately, as in which machine to be used when, how it is to be used, what is the force to be used, what are the combination of serums to be used. So if it's a good center that you're visiting, and if it's a good therapist, there is absolutely no problem. What is the downtime after a medifacial, is somebody is asking that question. Yes, so there is typically no downtime. If you go for a facial, how do you feel? I mean, immediately it feels soothing and relaxing. It's the same with medifacials. Occasionally in certain facials where peels etc are done or microderm is done, there may be slight erythema or slight redness on the face for about an hour or so after the procedure. You might feel some tingling sensation on the face, especially if microcurrents and radiofrequency are used to stimulate anti-aging in the skin. And sometimes if the mask is used on the face, that's the light mask, then you can feel some tingling sensation on the face. Otherwise there is no side effects absolutely. Someone wants to know what is the post care after a facial. Just like any other facial, you need to avoid doing a face wash the same day. You can wash your face the next day. Do not use products which are active products, as in the ones which have retinols or glycolic acid, salicylic acid. These strong products should not be used for the next 3 to 4 days. Avoid makeup for another 1 or 2 days after the facial, and that's the only skincare that's needed. Of course, a good sunscreen and a good moisturizer is always recommended, that you must use. So these are just the post care after a medifacial. Of course, there are other things to understand, that there is no pain. There are a lot of people who think that because it's a medifacial, you're using machines, technology, is there any pain? There's no pain. In fact, if you see some of the videos that the Aesthetic Clinics has posted online about our signature medifacials, you can see the patients feeling relaxed, soothing, and also enjoying the process. There is absolutely no pain, and there is no downtime. There is no side effect. You can do it right a day before your party or your function, etc. In fact, we do it for brides, etc. also. So especially for would-be brides and would-be bridegrooms, we can always put in packages of facials, combination of different facials like the Korean glass, the fire and ice, the signature facials, which they can do as a combination. So a couple of facials before the wedding will give them the look that they want on the D-Day. Okay. Yes, then there are certain questions now about another procedure. Yes, there is one question on LED masks in facials. Now, LED mask is something that is used not just in facials, it's also used in certain skincare procedures or procedures that are done by skin specialists for treating your skin. Now, what this contains, basically, it's like it's like a plastic mask that's put on the face, which has certain lights incorporated into it. So there are different lights which do different jobs, right? It has something called as blue light, which is good for acne treatment. It has yellow light, which is good for stimulating the skin, for soothing the skin. Then you have red lights, which are meant for fine lines, wrinkles, etc. And you have green lights for pigmentation. So depending upon the problem that the patient has, if you have pigmentation, then we use green lights. If you have a very irritable skin, we use the yellow lights, etc. So that is decided by the therapist who's doing the medifacial for you as to which lights are good. So typically in signature facials, we use the LED mask, which gives a really good effect in terms of immediate improvement and instant glow to the skin. Okay. Now we go on to something which is the other topic of discussion for today, which is basically the BB glow. And I think a lot of us might have heard about this. And BB glow, basically you must have heard what is BB foundation or BB cream, right? So these are creams which look like foundations which you apply on the face as a makeup. So that's what is a BB cream. So this is something similar which is called as BB glow. It's a kind of treatment, it's a kind of something higher than a medifacial. And basically what you can say in simple terms, in lay terms, is that it is medical camouflage. Okay, so it's like a semi-permanent makeup also, you can say. Now what is BB glow and why is it done? That is something that we should know. There's a lot of craze about BB glow going around nowadays and a lot of people are gaga about it. But what is it exactly? So what happens here is that it's a combination of different kinds of serums and nutrients that are provided to the skin, in addition to tint that is provided to the skin to give it an even tone and even complexion which stays for a long period of time, such that you do not even need to do makeup, etc., to hide your imperfections or your marks on the skin. So that is what it basically is. So say for example you're going outdoors, you have some pigmentation, you have freckles, you have fine lines, you have certain marks that you want to hide. So you put a makeup, you put a foundation and you go outdoors, right? So this is something, if you do the BB glow treatment, you do not need basically a makeup on your skin. You can just go because the procedure itself covers up all the imperfections, all the pigmentation, the fine lines, etc. onto the skin, and the skin looks nice and glowing for a couple of months after doing the treatment. So here in this, the indications for this particular treatment, it's a medical grade treatment done at a doctor's office only. So please note that it needs to be done at a skin specialist office only, and to prevent any sort of, to give you good results and to prevent any sort of side effects. Now what is done exactly in this treatment is, you come to the clinic, the doctor evaluates the skin. So people who can do it are those who have dull skin, those who have under eye dark circles, those who have pigmentation around the mouth, they have scattered pigmentation on the face, not very deep pigment, mild pigment, faint pigment, freckles. Then if you have fine lines, wrinkles, you want a good skin glow, you want rejuvenation, you don't have the time to put makeup, you just want to step out of the house, you get out of the bed and step out of the house. So people like this, okay, and people who don't want the hassle of putting creams, etc. on a day-to-day basis. They want something which lasts for a longer period of time, some sort of glow which lasts for a longer period of time. So that's where BB glow is indicated. And how it is done is, so there's somebody who's asking what is the procedure of BB glow. So the procedure of BB glow is that you go to the clinic, your skin is cleansed, it is exfoliated, the blackheads, etc. are extracted, and then there is a certain specific mixture of creams and serums which are used, which contain nutrients which have been selected by the doctor for suiting your particular skin type and the problem that you have. So if you have acne, you have post-acne spots, or you have post-melasma spots, or you have hormonal pigment, or you have dullness, or you have fine lines, depending upon that, the serums are selected. They might have vitamin C, they might have licorice, they might have hyaluronic acid, and so on and so forth, botanical extracts. So a whole range of nutrients are available. These serums will be applied to the skin, and they are penetrated deeper into the skin with the help of micro needling. So micro needling is a procedure which is done on the skin with the help of micro needles. There is an apparatus called as a roller. It's called as a derma roller or a nano roller. So this is used on the face, on the skin, to penetrate the creams or the serums that have been applied much deeper than they would otherwise go with just a massage. Okay, and then once the skin is hydrated, once it is nourished, then there is something called as a tint. It's a medical grade pigment that is put into the skin with the help of needles, the same micro needling, Micro needling is very tiny fine needles. It is not painful. It is not a needle. It is a micro very tiny needles which are used to stimulate the skin and to penetrate the pigment. So initially the skin is hydrated, it is nourished, and then the pigment which is desired by the patient, and depending upon the patient's skin color, what will suit him or her best, that color is put into the skin with the help of the micro needles. So that's how you get the even tone and the texture. So it basically is a cover up for the blemishes which are there onto the skin. And typically you need about 2 to 3 sessions, ideally 3 sessions of this treatment. Somebody is asking what is the number of sessions required for a BB glow therapy. We need about 3 sessions is what we recommend at the aesthetic clinics. Do it at an interval of about 2 to 3 weeks and see the benefit for yourself. Typically after about 4 to 5 months you might have to repeat the session again. But once you've done the treatment, the skin goes good for around 4 to 5 months and it shines and it doesn't need any makeup, no camouflage, nothing to cover the skin. Okay, how long will the results last? I've already mentioned, last for a couple of months. And if you take good care of the skin, you use your moisturizers, your sunscreens, your face washes, appropriate products for the skin, the results might last longer also. Okay, now what is the pre-treatment precautions that one needs to follow? Of course, prevent pigmentation or tanning before the treatment. Stop all active treatments. If you're on oral retinoids for treatment of acne, if you're on serums which contain retinols, these are all active ingredients. You can stop them about 1 or 2 days before the treatment and for 2 to 3 days after the treatment. What is the home care to be done after a BB glow? Anu is asking the question, what's the home care? There is typically not much of home care that is needed. Again, do not wash the face the same day. Use your sunscreen and your moisturizer as advised by your doctor and take care of the skin. That's typically just enough. That's the home care that is needed. Any side effects of BB glow? Not in particular. Occasionally there might be some sensitivity or redness onto the skin for a day or so after the treatment. Mild swelling may be in the place where it is done. Otherwise it's completely safe, and the next day or a day later you can attend all your responsibilities and your meetings, etc. Okay. Then somebody is asking whether BB glow is something that can be done for a long period of time. Yes, it can be done. There is no side effect, there is no harm. There is a question if it is similar to tattooing of the skin. You can say it's a form of cosmetic tattooing. It's not exactly the tattoos that we make on the body, but and it's not as deep. But yes, it is a form of cosmetic tattooing. It's also called as semi-permanent makeup. So semi-permanent is because it lasts for a couple of months and then you need to repeat it after a couple of months. There's a question on where should we get this treatment done. I would recommend please get it done at a dermatologist's office, because the sterility of equipment, the training of the therapist, etc. would be optimal, and you can also have the dermatologist consult as and when required for your skin. So it's always best to get it done at the dermatologist's office. Now another question, does it damage the skin? Absolutely no. These pigments are inert pigments. It does not damage the skin and it is completely safe to get these treatments done. Another question, is BB glow approved? Is it approved by the FDA? It is approved by the Korean FDA as of now, and Korean FDA is also one of the stringent FDAs that are available currently. So it is FDA approved, the Korean FDA approved treatments, and these are specific pigments. So the pigments for this treatment are not the regular pigments which are used for tattooing of the skin. These are specific medical grade pigments. So that's something that you must know about it. What are the results which can be expected with BB glow? Yes, I have already mentioned. Sometimes it's just immediate and instant improvement. As you can see, we have a couple of videos on our channels. We have a couple of videos about the procedure, how it is done, what are the results, and a lot of patients are really happy with the BB glow. Another question, can the BB glow and Korean glass facial be combined? Medifacials and BB glows, can they be combined? Yes, they can be combined. You can get a BB glow facial done and you can get the medifacials, which are the other medifacials like Korean glass, etc. done at intervals of 2 weeks. So you can alternate them and you can get really good results with this. Another thing is, okay, I think these are some of the questions which are there, and one thing to understand is that see, there is a border line, or there is a line beyond which certain treatments do not work. There is a line beyond which certain treatments have to be done. So you must always seek your doctor's advice. If you have a problem of pigmentation, or you have a problem of fine lines, or you have any other skin issues that you want to address, seek your doctor's advice, take their opinion whether you need to get into actual hardcore medical therapies which have to treat the skin problem and then shift on to maintenance therapies like the medifacials or the BB glow, etc. What is it that you need to follow? Or your problem is not that immense and you can directly go for the milder therapies like medifacials, BB glow, etc. So that is for the physician. The physician is the best judge to decide. Any results of any treatments which are done for skin care will always require maintenance. So maintenance is something, you've come to the doctor's office, you have some problem which you need to address. That's why specifically you are at the doctor's office, right? Because you want to get it cured and you want to get better. So once you have gotten better, please follow diligent maintenance as advised by the doctors to ensure the best results that you can get with this vast range of technologies and medical expertise that is available. So that is something which you all need to understand. Your lifestyle, your maintenance is what will count in the long run to keep you looking healthy and beautiful as always. There are certain questions which are being asked as to are these available in my city, my town? So you need to find out if they are available in your particular place, in your particular towns. And I think as the scope of these things are increasing, I think a lot of doctors are going to incorporate this into their practice as well. And I hope the best for all of you all. If there are any questions, you can always contact us. Our team is always there to help you, assist with all this. I think we've addressed most of the questions that we can with this particular combination of medifacials and BB glow therapies. And you need not be afraid. This is something which is being done. We've been doing it for the last say about a couple of years now, and we've gotten good results. Please ensure the physician that you go to, the therapist who is attending to you, and the technology which is being used is of good quality and good grade so that you get the best results. So I think we should wind up with this. Please let us know if there are any queries that we can address later. Thank you.